Good afternoon. As we see the surge coming, we see it matched only by a true surge of Hoosier generosity and kindness and determination, because whenever we have faced a challenge before, Hoosiers have always risen up to meet that challenge and to answer that call, and this time is absolutely no different whatsoever. We know that social distancing is the most important and, in fact, the most effective tool that we have to defeat COVID-19. That's how we are currently flattening the curve. So I'm encouraged that Hoosiers are hunkered down at home. And while social distancing may have us physically further apart, that's not prevented us from coming closer together to one another to meet each other's needs. And that's what this In This Together campaign is all about. You're gonna hear a little bit more about this from Eli Lilly and Company's CEO Dave Ricks here in just a few minutes, and how we can all help on this front. We're just so proud, quite frankly, to stand shoulder to shoulder with Hoosier businesses and prominent leaders all across our state in all 92 counties, like companies like Eli Lilly and Company and the Pacers and the Colts and Indiana University and Purdue University. We are all not going to be sidelined during this important hour in our state's history. So you'll be seeing some familiar and dare I say legendary faces representing the In This Together campaign, including MVPs like Vic Oladipo and Tamika Catchings, to name just a couple. And our shared goal is simple and straightforward. It is we need to act now, and by doing so, we all are going to save lives. I know that we're all looking forward to that day where we can get back to our more typical routines, our normal days filled with group activities and going to sporting events and taking in more kickoffs and tip-offs and spring trainings and hearing the engines roar. That day will come, but we want to get there sooner, not later. And right now, this is what every single person can do to help us realize that goal. If you take these steps seriously and do your part and help share this simple, straightforward, urgent message that we're all in this together, we will spread the word and our actions and not the virus. And because he practices what he preaches, I'd like to now turn it over to Dave Ricks, the chairman and CEO of the Eli Lilly and Company. Dave, you want to take it away from here?
Thank you, Governor, and thanks to also to Dr. Christine Boxer, who I know is working overtime these days, as well as our mayor here in Indianapolis, Joe Hogshead, who's been part of forming this, along with other partners, like you mentioned, the Colts, IU, Purdue, the Pacers, and so many businesses and nonprofits who are joining this movement to say we're in this together to practice great social distancing. Of course, there's so many efforts across the state that have been going on at our company, working on therapies for coronavirus, supplying the products, the health products we make every day that now seem as essential as ever, such as insulin. And I want to remind viewers here that we have our plants here in Indiana running full time to make sure your medicines will be there at the pharmacy counter. That's not something to worry about. And our heroic workers are coming every day to make those products. But today we're also here to talk about the launch of this campaign, about something we're in together, which is practice social distancing. As the leader of a scientifically driven company, we know from the scientists that the single most important thing we can do to flatten the curve and improve the outcomes of this pandemic in Indiana is to practice social distancing together. And it only works if we all do this together. And so as a reminder, those guidelines from the governor and the state Department of Health are to stay home unless absolutely necessary, to ensure physical distance when we are not home, and to make sure that we take care of ourselves and in particular, take care of and stay clear of those that have high risk, like the elderly, those with conditions like hypertension and diabetes. And by doing this all at once, we can speed this crisis along, get to the end we want to see, and keep as many Hoosiers safe as possible. So we're launching the campaign, which is the hashtag IN, like Indiana, this together. And there's a website called inthistogethercampaign.com. I encourage everyone to go there and share and to use this launch to really bring our community together around social distancing. We can do this the best of any state if we come together and remind each other every day how important it is. And as the governor just said, it will save lives. So the message today is spread the word, don't spread the virus. Let's have a great social distancing effort to get through this period and make a difference for all Hoosiers.
Thank you, Dave, and thanks for staying with us throughout this press availability. I'll now turn it over to Dr. Chris Box, our Health Commissioner.
Thank you, Governor. Every day I get to look at the most common questions that come in through our website, that come in over social media, and at the top of that list every day is testing in Indiana. So I will once again start with that. We have increased our testing capacity significantly over several weeks ago, as I've mentioned. In the last few weeks, thanks to partnerships with Eli Lilly and other private labs that have been coming on board. In fact, Lilly had their highest day ever yesterday in that they had 458 tests done for the state of Indiana, along with 436 tests that they did through their drive-through, testing healthcare professionals and other individuals that are high-risk populations. But we still have finite supplies, which is why we continue to promote targeted testing so that we can continue to make sure that our hospital systems that are testing our most acutely ill will be able to still have that rapid turnaround time for their results. We have released new testing guidelines today that show that this includes symptomatic individuals that may not have to be hospitalized, but that we know they're at high risk because of their diabetes, their immunocompromised. We further clarified that pregnant women are considered in that group and need to be tested, individuals that have high blood pressure or other medical conditions that place them at risk. Again, we want our providers to be the ones working with patients to decide who needs to be tested. This, again, will allow us to test more of our high-risk individuals across the state of Indiana, ensuring that while we have these finite supplies, that we are testing our most appropriate population. Today, we're also distributing an additional 3,000 kits, which include the viral swabs and the viral transport media that Lilly, again, made up for us. This will go to 9 different hospital systems that have indicated that they're critically low to be able to do the testing that is needed for this particular disease. We've also been told that all states will be receiving some of the rapid tests that have been developed by Abbott, and in fact, right as I was walking over here, I received an email saying that we would be receiving 15 of these specific machines, and with additional tests to come with that. I do not know when I'll receive those or exactly how we'll be using those, but that will be in the planning process in the next 24 to 48 hours, making sure that we're ready to add to the capacity of testing here in the state of Indiana as quickly as possible. Indiana also received additional supplies from our strategic national stockpile and is currently taking inventory of that and actually repacking those so that we can get those out to our hospital systems today. We are continuing to stock our long-term care facilities and EMS facilities and groups that are supplying emergency services for transport as needed. PPE continues to be in high demand. So we have a whole team of individuals who are working on trying to allocate and to receive and buy as many personal protective equipment, masks, gowns, gloves, anything that we can get, we are trying to get at this point in time and to stock that so that as needed we can provide that to our first responders and our healthcare personnel across the state. Businesses that want to donate masks, gowns, gloves, or other personal protective equipment can help our Hoosier healthcare system by reaching out to covidresponse@iedc.in.gov. Finally, I want to take a moment to recognize all of those who are on the front lines of this response. Whether you work in the hospital, EMS, in public health, or any other number of support functions, we could not do without you. Every day you put your own needs and the worries and your own worries aside to go out and to make sure that the sickest amongst us have the care that they need and the best possible outcome. Thank you for all your sacrifices and for going that extra mile, whether that means taking the jobs that you weren't necessarily comfortable with or are not within your normal duties, or finding a way to help families virtually visit with their critically ill family members so that in case they might not make it home. Everything you do matters and makes me incredibly proud today to be a Hoosier.
Thank you, Dr. Box. Unfortunately, as you just heard that report, this marks another day that we have a solemn duty of keeping the public up to date with some unwelcome but expected updates. And this daily balance of what we're all dealing with, our families and yours. On one hand, we're able to share just enormous acts of kindness and generosity, countless positive influencers out there that are not just performing that task themselves, but it's actually encouraging a lot of other people to step forward, folks who are not just sewing fabric, but seamstresses who are stitching together days for those folks who are most in need and for those folks who are caring for those folks who are most vulnerable. And then, in the other hand, we see this wake of destruction that COVID-19 is leaving in its wake, both from a personal, from a human perspective, and then, of course, from a fiscal or a economic perspective. And sadly, you just heard, we reported more fatalities. I think it's our highest day yet, that families are mourning and grieving and will be for a long, long time, 16 of them over the last 24 hours. We know that it's in 83 counties, spread to 83 counties, so it's at its highest it's been. We know that this is going to continue to spread. We know that this will continue to increase, whether it's positive tests in the infectious rate or the fatality rate or touching into all 92 of our counties. So let me just make yet another direct appeal to anyone out there who feels as if they are immortal or if they are viewing this virus as something that is inevitable, that we are helpless and that we can't do anything about it. The good news is we can fight back. We can slow the spread. We can flatten the curve. We know that COVID-19, this coronavirus, does not discriminate. We know that it can infect the healthy. It can infect the young. Maybe you won't be infected, but we know that it will use you to kill others. And so thank goodness we have the guidance and the ability to help one another get through this by social distancing, by making sure that we're not overburdening a healthcare system, keeping our capacity available region by region, whether it's in rural, urban, or suburban areas of our state during these unprecedented times and cases coming through the hospital doors. I know these steps may be inconvenient. Fine, we'll deal with that and we'll get through this. But we have to take these steps together. That's the End This Together campaign, and that is how we're going to slow the spread. I just plead with you. Don't gamble with your own life and don't gamble with others, because people are waking up today and they're dealing with not just a new normal, they're dealing with their families that have changed. So we've got to all, check in on your neighbors, but don't wait for COVID-19 to come to your door, come to knocking on your door. Do everything you can to make sure we're lessening the load. That just means simply Distance yourself from COVID-19 to the best of your abilities. And again, if it's not for yourself, do it for the first responders. Do it for the therapists and the doctors and the nurses and the EMS personnel. Do it for those people who are going into work. They're missing meals. They're doing double, triple shifts. They're not sleeping. It's almost as if they're wondering when they will be infected because they're caring for so many others who already are. And we have to keep them in mind. These 11,000, it's probably more than that since yesterday, 11,000 volunteers that Dr. Box reported on yesterday who are courageously stepping back into this arena. These are more than gladiators. These are lifesavers. And we have to make sure that they are equipped in the safest environment. If you're not thinking about them, think about the cashier at the grocery store who's watching family after family after family after family come through the line and pick out essentials, who are making sure that you're able to get that food on the table. Do it for the most vulnerable that Dr. Box just mentioned, the senior citizens in our state who are, the most vulnerable. If they want to get back to the days where they can spoil their grandkids too, and we want them to get there, and we can, but we're going to do this together. And I just want to underscore yet again today, I could do this for 24 hours. There is so much good going on out there. It makes me so proud to be in this state and to be going through something as challenging as it is, with everyone that's stepping up. When you think about being in the most manufacturing intensive, we're the #1 manufacturing state in America, but per capita. We know how to make things. We know how to innovate. We've been doing it for over 200 years. And you are watching businessmen and women out there turn and burn on a dime and change their business line to be able to accommodate for what the needs are, not just of the day, but of the hour. And they are responding to their local hospitals and their local health clinics. They are putting their profits aside right now, and they are supplying us. There's a company that forever, for years and years and years, made products for quads, and it's now making the stands for shields that go in front of a clerk at a store or in a post office or in a doctor's office. One of the leading states in America, auto manufacturing states in America, I want to thank Honda. Honda is supplying, down in Greensburg, Honda is supplying their local fire department, their firefighters, with these paint suits and masks. They're getting their products off their assembly line, out of their plants, and they're getting them to the folks that are using them right now, every day. These people are doing double and triple shifts. So when you think about this occurring all over the state of Indiana, when you think about local banks, I want to put another shout out to our federal partners. Senator Todd Young was leading the charge to make sure this stimulus package that came through, we're now on our third, one of them incorporated some rule changes that allowed community banks, our banks, to change the rules so that a bank down in Napoleon, there's a Napoleon, Indiana, if you're not aware of that, and there's the State Bank, in Friendship, Indiana. Two small community banks that have a COVID-19 hardship support program in place that are allowing folks, if you're taking out a commercial loan or a business loan or your mortgage or a personal loan, ag loan, you can delay those up to 90 days. These banks around the state of Indiana understand what we're going through. And they are, again, changing their business model to help us weather this storm. And it's happening in small towns and big cities. We just talked about with Dave Ricks, Mayor Hogshead here, and the Indy Chamber here, setting up a $10 million support program. We talked about the Evansville program and it's happening all over the state of Indiana. And I just want to encourage, we got to keep turning and burning. And we got to keep our foot on the gas. We cannot let off. As we head into this surge period and this surge phase, we need more togetherness. And that is what is going to see us through this all. So with that, I think everyone who has gone way up and beyond the call of duty, whether you wear a uniform or you're retired and now you're back in the game, thank you, and I'd be happy to, and Dr. Chris Box would be happy to answer any question you might have. We have the complete task force with us again today. So if it's not a topic that you think you'd like us to answer, we can call on the National Guard, the State Police, or the Department of Workforce Development, et cetera. First question.
Up first, Eric Berman, WIBC.
Good afternoon, Eric. I can hear you. I could hear you.
We get it this time.
I gotcha.
Excellent. As far as the social distancing, last week Commissioner McGinnis joined you. He said we were at 41% of traffic on the highways. That's still an awful lot of cars, and the order that limited what businesses could stay open was, if I recall, 21 pages. There's a lot of businesses still considered essential.
Yeah.
Does that need to be tightened up further to accomplish the social distancing you're talking about?
I don't think at this time. Of course, we evaluate this by the hour. We look at what are essential businesses. We understand, folks have to get to the grocery or to the doctor. Life is different. But life will continue, and we'll absolutely be monitoring. It's also we're developing very direct and efficient lines of communications. I should be making a shout out to my first call today was with a county commissioner up in north central Indiana. My last call just before this meeting started was with a number of governors from around the country. We're all dealing with making sure the folks who are out and about, carrying on with the essentials, are doing so in a responsible way. But Eric, yes, we'll continue to on a day-in, day-out basis. We're in this for the long haul. And if something needs to change today or tomorrow, we'll make that call.
Rob Burgess, the Wabash Plain Dealer.
Hello again, Rob.
Hello again. Thank you again for doing this. I really appreciate it.
Yep.
Quick question for each of you. Governor, when will you make a final determination on either extending the stay-at-home order or schools reopening, and are stricter travel bans being considered at this time? Dr. Box, what advice would you give for pregnant women with due dates during this coming surge? Will they be able to give birth at their local hospital safely? And Mr. Ricks, if you're still there, Eli Lilly has recently expanded drive-through testing to include essential workers who come into contact with the public, but not yet the public at large. As there are many asymptomatic carriers who might not know it, especially young people, are there any plans to expand testing further? Thank you.
Yeah, Rob. Many of our dates are in 2-week increments. We'll make an effort to align as many of those as we can. The next update that we'll have will be within a week to give folks notice and time to adjust. And again, I'll just repeat myself in terms of the second question. We're gonna continue to monitor everything on a minute-by-minute basis, and an hourly basis, and a daily basis. So while we don't have any new executive orders today to speak of, stay tuned. We'll be here tomorrow, and we will.
And with regards to pregnant patients, there's no indication that we're not going to be able to continue to have our obstetrical units have women who are pregnant come in with their significant other and deliver their babies in a very healthy fashion. I would say we're going to be very limited on letting people come into hospitals. I would imagine there probably won't be any visitors other than the significant other and mama and baby together. And if your significant other is sick at the time, we probably won't let you be there for the delivery, and that'll be very difficult, but we would not want to expose mom to that and a newborn baby. So we're going to try to continue business as usual because we understand these are two or three of the most important days of your life, and we want to continue to have that be a very happy process for you. The second thing, oh gosh, I forgot what it was. Can you repeat your second part of your question?
He had one for Dave Ricks as well.
Oh, I know. He wanted to ask Dave Ricks about the drive-through testing and that we have expanded it to essential personnel. Do you want to answer that, Dave?
Too, Christine, and appreciate the partnership all on the way. We've been growing our capacity and expanding it over the last week or so, testing over 6,000 people so far. We're trying to make the biggest impact we can on public health. So we started with healthcare workers, many of which who are quarantined but may not have the virus. And we're working with the local hospitals to make sure those individuals can get back to work into the healthcare system and expand the capacity to treat patients. And those that do have the virus know it and can stay at home for the period of time required. We then added first responders who we know also are at risk, and for the same reason to make sure the state has capacity to respond to emergencies. And then now today we announced we're expanding that further because we have the capacity to do it for those frontline, what we're calling frontline essential workers, just like the governor mentioned, people who are checking out at your grocery line, pharmacists, people who are in contact with the public for essential duties, things we need to do to keep our households running. And then also we've included symptomatic patients in the general public who have those high risk factors, typically seniors and people with comorbid conditions. What we're trying to do is carefully calibrate how much testing we can do right now with the highest impact we can have on public health. We probably will be at this point for a while and not expanding to the general public. Of course, our goal would be to have general testing available more broadly over the coming weeks to absorb that kind of need. So hopefully that answers your question.
Thank you, Dave. I also wanted to just wedge in here real quickly before we take the next question, Rachel. Today is National Census Day, and I just ask every Hoosier, while it's on your mind, I may remind you from time to time, to make sure that you fill out your information. This is critically important to the state of Indiana, to every state in the country and territory. But it also gets down to the very local level. This determines where funding is going, and of course determines the makeup of our congressional delegation. But it's has a lot to do with how funds are allocated to your city or town and to the state of Indiana. And so while the federal government has rightly pushed back the deadline for that, you have at your means and disposal the ability to fill out that information, whether it be on the phone or the internet. So I would just make an appeal to you to make that a priority, because it certainly is. Our voices, every voice in Indiana needs to be heard, and this is the window. So you've got, the deadline is July, August time period because of COVID-19's interference and interruption, but that doesn't mean you need to wait until then. Next question.
Ken from the Associated Press.
Hello, Ken.
Ken?
Yes. Are there any steps that state agencies are taking to address virus outbreaks happening in rural parts of the state, specifically in the Decatur and Franklin counties areas?
Most certainly. We have, again, talked about strike teams here in the state of Indiana. We now have 11, so we cover all of our 10 preparedness districts, and the 11th kind of can move around and do whatever. wherever they're needed. But we are going out and testing in long-term care facilities or healthcare personnel to help then also epidemiologically and follow those cases up with the local health departments there. So we've been working very closely. In fact, Tim Putnam with Ripley County actually had been a prior president of the Rural Health Association and specifically had given us some guidance about further assistance that rural health areas in the state might look for and need help with. So we're working very closely with them going forward on testing and further follow-up.
Michael from WBEZ.
Hello, Michael.
Good morning, Governor, and thank you so much for this. You guys have been doing an outstanding job down there. My specific question is for Dr. Fox, and it has to do with this surge. With Lake County, Indiana, neighboring Cook County in Illinois, which includes Chicago, which has 4,500 confirmed cases and 61 deaths, how do you see this impacting Lake County and the rest of Northwest Indiana? And are we part of their wave or surge or Indiana?
That's a really good question. The platform and EM resource that we have actually can allow us to work with other states. So if that becomes more of an issue, I can work with the state health commissioner in the state of Illinois. But we have been looking at the data for major cities that surround the state of Indiana, like Cincinnati and Louisville, and Chicago pretty much on a daily basis now for at least the last 2 to 3 weeks so that we can keep track of what's happening across our borders because we know that this virus does not respect the border, obviously. So as we work and plan, we talk as a part of our planning, where do most of your people get your health care? Where do you transfer most of your patients? We have other areas of the state that actually do take patients from across the border in Illinois, like over in Vigo County and down in southern Indiana in the Vanderburgh County and Warwick County areas. They do a lot of care for individuals that live in Henderson, Kentucky, and in the southeastern part of Illinois. So all of that is taken into account as we do our planning.
Brandon Smith, Indiana Public Broadcasting.
Hello, Brandon.
Hey, Governor. This one's for you and Dr. Box. First, Dr. Box, you talked about how the state is continuing to expand testing, and yet we've actually seen the increase in the number of tests each day start to slow down over the last couple of days. So why is that happening? And then, Governor, what exactly are you telling President Trump about the critical need for more testing in the state of Indiana?
So when we look at the testing, Brandon, I agree with you that we see peaks and then we see it drop below the level of the actual line that we see on the graph that shows this continues to increase. I think part of that has to do with as additional labs like LabCorp and Quest, as they report out Indiana's labs to us, they come in at different times. So I don't always have control over how that gets reported. I can just tell you that I know that we had Deaconess Hospital come online with testing. We have individuals working at Purdue University to get more testing. We have the new lab in the northwest part of the state that is doing testing for the Lake County area and Porter and LaPorte. So I'm confident that the testing is increasing, and I just think that there are numbers that wax and wane there.
Yeah, and Brandon, I would say that I give the administration, our congressional delegation, every other governor that I'm on multiple phone calls with on a daily basis, making sure that we're sharing information like testing, making sure that we have, and we do right now, have what we need to address this surge. A lot of this is, we're fortunate in the state of Indiana to have, as Dr. Box just mentioned, private labs and to have Lilly here, to have IU Health that are doing testing. We want to make sure, most importantly, that we're testing the folks that need tested, that we're not making a run on the supply if you are one of the worried well, or if you are not experiencing symptoms. If you have a high fever, if you have a respiratory issue ongoing, you need to reach out to your doctor. They're going, or your healthcare provider. They're going to be the one that makes the call to get you in to get tested. And so we can do this. We can do the front line. We can do the most vulnerable and do it in a very responsible way that doesn't deplete all of our resources all at once.
Jeff Smith, WLFI.
Hey, Jeff.
Hello, Governor. Can you hear me?
I can, loud and clear.
Thank you very much for doing this again today. Hey, I believe it was Monday that Dr. Box talked about ventilators. Can you tell us what the projection is for the number of ventilators needed at surge in the state of Indiana, where we are now, and what's the plan for making up the difference?
So those are really good questions. First of all, I would say that the number of ventilators we're going to need based on the surge that we expect is all over the board. What we're trying to do is get Indiana-specific data fed into actually programs so that we can determine a little bit more closely what we think our surge is going to need to be. We've been working from the concept based on what earlier states had said, that we're going to need at least 2 times that number, and we are increasing those numbers on a regular basis just based on allocation of ventilators from, as Dr. Sullivan so aptly showed the other day, additional ventilators that come from surgery centers, that come from potentially veterinary practices that we can actually buy, additional ventilators that are with EMS and other individuals like our National Guard.
Yeah, look, can I also chip in here and go back to Brandon, because I want to use this opportunity to say that Brandon, and to everyone, every time I talk to anyone, I say we need more. Pour it on. We're not content right now. We can always use more. One thing that's really invigorating, quite frankly, is when it comes down to PPE, tests included, but when it comes down to gowns and gloves and masks, surgical masks, the N95 masks, I'm crystal clear that we want and need more. And one of the comforting things is that so many people are stepping up and helping us bridge that divide in different parts of the state of Indiana. But of course, we're going to continue to make requests of the national stockpile. Of course, we're going to, every time I'm on the telephone talking, and the Commissioner of Health, Dr. Chris Box, of course we're making the case that we don't want to become one of the pronounced hot spots in the country. But that's going to also come down to, maybe most importantly, our own behavior. And that's what we can adjust. And could be at the end of the day the most critical thing we can do.
Abdul Hakim Shabazz, Indy Politics.
Hello, Abdul.
Good afternoon, Governor. You're a pleasant distraction from decluttering. I can tell you that right now, sir.
I suspect you have a lot of clutter.
2 questions real quickly here. A, do you have any plans to be tested soon with the incoming surge? And number 2, what is the likelihood of expanding our stay-at-home order while we deal with the surge over the next 2 to 3 weeks?
First, I don't exhibit any of the symptoms, and I'm looking at doctors that are looking at me, and they would correct me if I answered this wrong. I don't need to be tested right now. Should that day come, I will be. And odds are, I'm in relatively good health. I will get through it just fine if infected. But I don't want to be. So I am practicing social distancing to the extent that I can every single day. I don't want to be a hypocrite here. I don't want, when I'm out and about picking up groceries, I keep 6 feet between me and the cashier. And I just ask everyone play by those same rules. In terms of your second question, I think you asked what are the odds or the likelihood. Read into this what you want. I answered this earlier that said that within the next week you'll learn more, but we're not at the peak yet. We're looking way up at the peak, and so we're on our way up. So I don't want anyone to get complacent or think that this is this is soon to be in our rearview mirror. We're sailing into this storm together, and we're going to need every hand on deck to negotiate these rocky, shallow waters ahead. So prepare to stay hunkered down, Hoosiers.
Marcus Green, WDRB Louisville.
Hey, Marcus.
Hi, Governor. I just wanted to clarify something that Dr. Box said earlier in the briefing. She mentioned the national stockpile. Has Indiana received an additional distribution from that stockpile, which would I think be a 4th, or were you referring to the 3rd shipment that came earlier in the week?
I was referring to the third shipment that we just, actually, one of the trucks kind of got lost on the way here, so they had to kind of repick it and send it to us. So we just completed that, got here late last night.
And if I could just ask one follow-up question, can you say if any health departments or hospitals or first responders have requested PPEs that they've not been able to receive yet?
To date, we have not been able to fill anybody's request.
Russ McQuaid, Box 59.
Hello, Russ.
Russ, you have to unmute your own microphone.
You want to come back to Russ?
We'll come back to you. Nikki Kelly, Fort Wayne Journal-Gazette.
Hello, Nikki.
Hello, Governor. I was wondering if you had heard anything back on the FEMA declaration request, and also what our infectious rate and mortality rate is.
You want to take the first one and then...
The FEMA request for
or
further...
the second one, if you want to take
Okay.
the second one, and I'll get Steve up here to...
Okay. So because we don't have a handle on everyone yet who has been tested in the state of Indiana, it's hard to say what the mortality rate is. You need to know all the negatives, right, in order to be able to know the number of positives then who died. So we know the number of individuals who have died. I just don't know the number of individuals that have all tested positive yet. That's coming in gradually. So we should be able to give that to you shortly as we have more of our counties on board with reporting this data in through the IHI and other systems.
So my name is Steve Cox. I'm the Executive Director of the Indiana Department of Homeland Security. The governor on Monday signed a letter requesting a major disaster declaration for the state of Indiana. It was submitted to Region 5 FEMA on Monday evening, and as it stands right now, we've been told that it is now at the White House under review, and we anticipate getting a response hopefully within the next day or two in regards to that.
Joy from PBS, Michiana.
Good afternoon, Joy.
Good afternoon, Governor. This is a clarification question for Dr. Box. For those people who want to donate gloves or masks, where did you mention they can reach out to? And are there specific guidelines to the kinds of masks that you'll be accepting?
We will accept any mask that you have. We have no problems with the masks that you give us. We will use them no matter what, even if it's on top of our N95 masks to keep from soiling them. And that is the COVID response at iedc.in.gov.
Thank you so much.
Thank you.
Mary Mills, WTHR.
Hello.
A lot of Hoosiers obviously unemployed. Many more will soon be joining the ranks, worried about paying the rent, paying bills, etc. Big question, are furloughed workers the same as laid off workers when it comes to applying for unemployment?
Yeah, I'll have Fred Payne, Commissioner of the Department of Workforce Development.
Workforce Development. Are furloughed workers considered treated the same as laid off workers? Is that your question?
Yes, it is.
Okay. Well, it depends on who's the employer for the furloughed workers. If it's a federal government entity, then their rules will apply. Otherwise, if it's a private entity, then the layoff rules will apply under our state statutes.
But what about if you're furloughed versus laid off? You're temporarily, furloughed versus laid off indefinitely.
Right. If you are not receiving, if you're not receiving payments, then you can probably receive benefits under our unemployment compensation system. You'll still just have to apply, and then we'll evaluate that claim.
Whitney Downard, CNHI.
Hello. Hi, Whitney.
Hello. I wanted to ask, also kind of jumping off of that unemployment, we've had increased demand for other social services, food assistance, women and children, WIC. I was just wondering if I could get a general comment on how we're going to fund these additional demands and keep making sure that more Hoosiers have that access to those resources.
Dr. Sullivan will take that question.
Jennifer Sullivan, Secretary of Indiana Family and Social Services Administration. The SNAP program, which is under FSSA, is a federally funded program, and we are continuing to evaluate benefits on a daily basis. We have an increased number of applications and are filling those needs currently. As well, we released guidance over the last week to make sure that anyone who is currently on SNAP will continue to receive those maximum benefits over the next 3 months. Those federal funds continue to come through to Indiana, and we will continue to utilize them for everyone who needs them.
Cameron Riddle, WRTV.
Hello, Cameron.
Hi, good afternoon, Governor. 2 questions for you. In New York, the naval ship Comfort is being used as a non-coronavirus patient hospital. We talked about the other day how in Indiana, every hospital is going to be ready to take coronavirus patients. So is there a location that will be just for folks who have a broken arm or somewhere that they can go? And then secondly, you talked about people feeling immortal. And with that in mind, the new data today appears to show at least 1 death of a person between 30 and 39 years old. Without getting into HIPAA violations, what can we know about that person, and what can that teach us about this?
Well, let's take the second one first, Dr. Box, and then we'll go over to Dr. Sullivan.
So I think what it teaches us, and first of all, I can't give you any more specifics about that individual's age or their underlying health conditions, but what I can say is that it teaches us that this can hit anybody hard. It's not just our elderly people who will die or have severe consequences with this. So this is not something that anyone wants to take lightly, and that's the point we've made. Influenza takes lives of young individuals all the time when we don't always understand why that happens.
Sherry?
Jen Sullivan, FSSA. As we look through the models for surge planning across the state, alternate care sites, both for COVID individuals and non-COVID individuals, are part of that global package to make sure that we have plenty of space to take care of people who have healthcare needs today that are non-COVID related, and also as we see the surge of COVID patients. We're identifying sites that are existing, so outpatient clinics, hospitals that might have recently closed or not yet opened for those pop-off valves for additional patients. And then additionally, in what we affectionately term Plan B of surge, alternate sites that are like the ones that you described, that are non-traditional hospital spaces, to make sure we can continue to provide high-quality care to all individuals.
Thank you. Before we go, I think you said, Sherry, before we go there, just let me take a moment. I mentioned it was Census Day. It's also formerly known as April Fool's Day, and I would just ask anyone, because I've received a number of calls and texts referring to things, executive orders that were signed today. There were none today. And get your information from the Department of Health's website, that coronavirus website. Don't get it from someone who's forwarding a forward that's been forwarded. Get your information from the Department of Health. And I would just ask you to make sure that this is what day it is. It's hunker down Hoosiers. It's stay at home. And so I loved just the community spirit all over the state of Indiana, where people are coming up with very creative ways to saying that we can do this, and we're going to do it together. And I think you said Sherry's next?
Sherry with the Indianapolis Star.
Yes. Hello, Sherry.
Hello, Governor. Can you hear me?
I can.
Okay, thank you very much for taking my question. I have one longer question, one quick question. The first is, there's an Institute for Health Metrics and Evaluation tracking program that shows Indiana having as many as 1,000 deaths by, I think it's actually 1,003 by the end of August. I was wondering if there's any special planning being done to handle an increase in deaths for the state, somewhat comparable to what's being done for hospitals. And then the other quick question was just if you could tell me if you know how many nursing homes in the state have had cases.
Sherry, I'm sorry I don't have that number for the nursing homes. I do know there are quite a few, but I can get that number for you, and we can get that to you because we've been engaged in testing and on the ground with those nursing homes for the most part. The second part of the number, are you wanting to speak, Steve, to that? The second part of that number, I think Steve Cox is going to speak to.
So as part of our activation of the State Emergency Operations Center, we have a planning section that currently is working on multiple different aspects of mortuary assistance, working in direct contact with the State Funeral Directors Association and others, coroners, et cetera, throughout the state to make sure that we are adequately handling any kind of surge issues associated with that. So,
again, all of our behavioral changes are going to affect that ultimate number.
Erica Irish, the State House file.
Yep. Hello, Erica.
Erica, you should be able to speak. We'll come back to Erica. Lindsay Doty, the IBJ.
Yep. Hello, Lindsay.
Hello, Governor. Can you hear me?
I can, loud and clear.
Okay, great. I'm curious, you had previously said that you thought most Hoosiers were listening to the social distancing requirements or suggestions and were taking this seriously. So why is this In This Together campaign something you felt was necessary to launch?
Well, it's number one, it's a good aspiration. Regardless of whether you believe we are or not, we are all in this together, and we'll get through this together. This is one thing that I'm pleased about, is it's pulling our state together, unlike any time I've seen before. And I, have a lot of conversations with a lot of people that remember significant events, whether where you were when President Kennedy was assassinated, or during 9/11, or now this. And this virus that is ravaging our communities and our families across the world, the states that come together and collaborate, understanding that there are, of course, different levels of government, federal, state, local, and there are different communities inside each of our states or nations, meaning that rural, urban, and suburban. And all the lines go away. When you're at home and you're sewing a mask and you're sending that off to Evansville and you live in Delphi, or you're sending it to West Lafayette or Lafayette, we're going to get there and through this faster together. So we never want to let up. We're in the beginning of this. We're not at the middle yet. We're not at the peak. So the more the merrier. We all need to be rowing and oaring in the same direction. And that's what this is about, a team of Hoosiers, 6.7 million. That's why I'm so stoked about having the Pacers and having the Colts and having IU and Purdue and anybody else that wants to join the team, by the way. We all have one play to run, and we're going to get through this a lot faster together. It's that simple and yet profound.
Russ McQuaid, Box 59.
Russ, let's try it again.
Russ. Oh, we've lost Russ. We'll go to Erica Irish with the State House file.
Hello, can you hear me now?
We can.
Thank you, Governor. I apologize.
No.
My question can be answered by either yourself or Dr. Box, and it's in regards to the White House press briefing that was held last night. There were some new projections about deaths nationally, between 100,000 to 240,000 with the current mitigation efforts. Should Indiana be prepared to support a national shutdown either now or in the future? And what could it add to protections in our state?
Well, we support the long view that the president has put out there, and he's extended it to 30 days from that initial 15. We've operated somewhere in that time frame as well, 14 to a 30-day period. What we'll do here in the state of Indiana is our part, and a lot more. You see, the generosity has extended outside our borders in some cases, but we've got our work cut out for us here. And the best thing we can do for America is take care of our own right now.
That concludes today's briefing. Governor Holcomb's next briefing will be tomorrow at 2:30 p.m. Eastern. Thank you.